Prostate cancer is a type of cancer that begins in the prostate gland, which is a small, walnut-sized organ located just below the bladder in men. The prostate gland's main function is to produce some of the fluids that make up semen, which is involved in carrying sperm during ejaculation. Prostate cancer occurs when the cells within the prostate gland start to grow uncontrollably, forming a tumor. If left untreated, these cancerous cells can spread to other parts of the body. Now, let's discuss how age, race, and family history can be factors in the development of prostate cancer. Age. Age is a significant risk factor for prostate cancer. The likelihood of developing prostate cancer increases as men get older. It's relatively rare in younger men, but becomes more common with age. Most cases are diagnosed in men over the age of 50, and the risk continues to rise as men reach their 60s and 70s. Race. Race can also play a role in prostate cancer risk. African American men have a higher risk of developing prostate cancer compared to men of other racial backgrounds. They are not only more likely to get prostate cancer, but also more likely to have an aggressive form of the disease. The reasons for these racial disparities are still being studied, but may involve genetic factors and access to healthcare. Family history. Having a family history of prostate cancer can increase an individual's risk. If a close relative, such as a father or brother, has had prostate cancer, the risk is higher. The risk further increases if multiple family members have been diagnosed with the disease. This suggests a possible genetic predisposition to prostate cancer within certain families. Today we will look closely about the 5 early warning signs of prostate cancer. Remember, this video is for educational purposes only and not as a medium to replace our medical practitioners. A painful or burning sensation during urination or ejaculation can be warning signs of prostate cancer due to the location of the prostate gland in the male reproductive system. Let me break it down in simple terms. The prostate gland is a small organ located just below the bladder in men. It plays a role in producing semen, which is the fluid that carries sperm. When prostate cancer develops, it can sometimes affect the nearby structures, like the urethra, the tube that carries urine from the bladder out of the body, and the nerves and blood vessels involved in sexual function. So, when cancer grows in the prostate, it may press against or block the urethra, causing discomfort or pain during urination. Similarly, it can interfere with the normal functioning of the prostate during ejaculation, leading to a burning or painful sensation. These symptoms occur because the prostate is closely connected to the urinary and reproductive systems, and any disruption in its normal function can lead to these warning signs. It's crucial to understand that not all cases of painful urination or ejaculation are due to prostate cancer, as other conditions like infections or benign prostate enlargement can cause similar symptoms. However, if you or someone you know experiences persistent discomfort or pain in these areas, it's essential to consult a healthcare professional for a proper evaluation and potential prostate cancer screening. Early detection and treatment can significantly improve the outlook for prostate cancer. 2. Frequent urination, particularly at night. The prostate gland is a small organ located below the bladder in men. It surrounds the urethra, the tube that carries urine from the bladder out of the body. When prostate cancer develops, it can grow and press against the urethra like a clamp on a straw. This can narrow the urethra and make it harder for urine to flow freely. Because the urine pathway is partially blocked, the bladder doesn't empty as efficiently as it should. As a result, you may feel the need to urinate more often, including during the night when you should be sleeping. This frequent urge to urinate, especially at night, is a common symptom of prostate cancer. It happens because the prostate gland's abnormal growth is interfering with the normal process of emptying the bladder. 3. Difficulty stopping or starting urination. Difficulty stopping or starting urination can be potential warning signs of prostate cancer due to its impact on the prostate gland. Let's break it down in simpler terms. The prostate gland is a small organ located beneath the bladder in men. It's positioned around the urethra, which is the tube that carries urine from the bladder out of the body. When prostate cancer develops, it can cause the prostate gland to enlarge or become irregular in shape. As this gland grows or changes, it can squeeze the urethra, which acts like a tube for urine flow. This squeezing can make it harder to start urinating because the urine has to push through a narrower pathway. It can also make it difficult to stop urinating because the prostate's irregular shape can obstruct the normal closing of the bladder's opening. So when you have prostate cancer, these symptoms occur because the gland is affecting the smooth flow of urine. 4. Sudden erectile dysfunction. Sudden erectile dysfunction can be a potential warning sign of prostate cancer due to its impact on the prostate gland and its proximity to important structures involved in sexual function. The prostate gland is a small organ located below the bladder in men. It plays a role in producing some of the fluids that make up semen, which is involved in sexual activity. When prostate cancer develops, it can grow and spread, potentially affecting the nerves and blood vessels in the area. These nerves and blood vessels are essential for achieving and maintaining an erection during sexual activity. If prostate cancer interferes with them, it can lead to problems with getting or keeping an erection, which is known as erectile dysfunction. This occurs because the cancer's growth can disrupt the normal function of these structures, making it difficult for blood to flow into the penis and maintain an erection. It's important to note that erectile dysfunction can have various causes, including factors like stress, age, and other health conditions. However, when it occurs suddenly and is accompanied by other prostate-related symptoms or risk factors, it may be a reason to consult a healthcare professional for further evaluation. Detecting prostate cancer early is important for timely treatment and better outcomes. 5. Blood in urine or semen. The presence of blood in urine or semen can be potential warning signs of prostate cancer, because the prostate gland is involved in producing some of the fluids in semen, and prostate cancer can disrupt this process. Let's break it down in simpler terms. The prostate gland is a small organ located beneath the bladder in men. It's responsible for producing some of the fluids that make up semen, which is the liquid that carries sperm during ejaculation. When prostate cancer develops, it can cause changes in the prostate tissue, including the blood vessels within the gland. As prostate cancer progresses, it may damage these blood vessels, making them more likely to leak blood. This can result in blood mixing with urine when you urinate or appearing in semen during ejaculation. In other words, the presence of blood in urine or semen can be a sign that something is affecting the prostate gland, and one potential cause is prostate cancer.